you got there?
We're gonna touch base on honesty.
On honesty.
Brian Hamilton is a Tucson-based recovery support specialist.
Earn that respect for yourself.
He helps people with addictions, and he speaks from experience.
My drug of choice was heroin.
He used drugs more than 20 years and overdosed 4 times.
You would think I'd be scared. You think that would have been a wake-up call, but no, it was, that's this, you wake up and from an overdose, and the first thing you want to do is get high again.
Hamilton says his biological parents were addicted to drugs and ran a meth house. When he was 8, he was removed from their home and sent to foster care. However, the sexual abuse that had already begun lasted until the age of 12, when he says he was finally big enough to fight back. But that's when he was also introduced to heroin.
By the time I was 14, I was already a full everyday heroin addict, IV drug user. I mean, I should have been like going to dances and prom, and then no, it wasn't me. I was stealing bottles of alcohol with 30-year-old homeless people so I can sell it to the tattoo shops and get high. And all you can think about is that warm blanket that you feel from the substances. You don't think about, hey, I may die again, or this could be the end of my life right here. It's more like, I'm okay with dying. It's a lot easier than living. And it's a scary thought, it really is.
A life of crime in different states landed him in prison from 1999 to 2015. 1 year later, more legal troubles, but he was able to get into Pima County's Drug Alternative to Prison program.
I actually told them that you give me this chance and I will not let you down. And I literally went through that whole program with not one single relapse. I have been clean and sober with no bumps in the road since February 18th, 2016. Promotes recovery. It helps you.
Now he works for Community Medical Services, which provides treatment for people who abuse substances. The company was founded in Phoenix in 1983 and has since expanded to other cities and states. Much of the work centers around opioids, which have become dangerously prevalent and deadly all over the country.
Just the sheer number of these makes it a health crisis, but also the hospitalizations, the emergency services that are required.
Mark Person is the manager of the Pima County Health Department's Community Mental Health and Addiction Team. He's very concerned about the current number of overdoses. The county is on track to surpass more than 500 deaths by the end of this year, a new record for a 3rd consecutive year. Person says fentanyl, a non-pharmaceutical synthetic opioid, can be 50 to 100 times more toxic than heroin or morphine. Fentanyl is currently responsible for more than half of the overdose cases in this county.
Really, really dangerous because of the unpredictability of it.
In addition, Person says overdoses are now the #1 killer of people 19 years and younger in the community, more than traffic accidents, firearms, or any other cause.
It's kind of the perfect storm where you have a cheap drug, really accessible, a lot of stress, so there's high demand, and then you have it falling into the hands of young people that aren't really experienced and not aware of the risks, and unfortunately that's led to a lot of tragedies here in our community.
Fortunately, Person says there's an approved medication known as Narcan that can save lives. Pima County Public Libraries have it available as part of a partnership with the health department. This nasal spray contains the legal drug called naloxone that helps reverse an opioid overdose. Experts say there are many reasons people abuse drugs, and the coronavirus pandemic has made it worse.
There's a shortage of resources already. So now, with this kind of crisis, it takes the whole community to come together.
Factors can include anxiety, depression, domestic violence, isolation, job losses, and recent cancellations of in-person learning and activities. For Brian Hamilton, it all began early in his life.
Trauma and no decent role models, wanting to fit in.
But as Hamilton approaches his 40th birthday, he says he's never been happier. He has a loving wife and pets, a full-time job he enjoys, and the opportunity to help others break their own cycles of addiction.
I'm so grateful for the people that were there for me to allow me to live again. Camping, riding a bike. Like, I've been homeless, but I've never been camping. Big difference. Fishing. I've never been fishing. Little things like that. So those are the things I'm looking forward to doing in my recovery, is going out and fishing and just being a normal human being.